Hello, today's topic is neonatal sepsis. Neonatal sepsis is one of the commonest cause of newborn admissions in NICU, and this is one of the important topic in neonatology. This topic I'm going to discuss in two classes. Today I'll talk on definition, classification and clinical findings, and next class I'll talk on the lab investigations and treatment or the management part. Neonatal sepsis is a serious bloodstream infection occurring in the newborns. It is a major cause of newborn morbidity and mortality, especially in the low resource settings. Let's start with the definition of neonatal sepsis. Neonatal sepsis is a systemic inflammatory response syndrome which occurs as a result of suspected or proven infection in first 28 days of life. It involves the invasion and multiplication of pathogen in the bloodstream. Let's see the search criteria. This requires two or more than two of the following points. So number one point is temperature instability, which can be fever or hypothermia. Either fever or hypothermia. Second point is tachycardia. Third point is tachypnea or hyperventilation. And then fourth point is leukopenia or leukocytosis, or IT ratio more than 0.2. As I already said, neonatal sepsis is the most common cause of NICU admissions. And globally, the prevalence in the developed countries is approximately 1 to 5 per 1,000 live births, whereas in the developing countries it is approximately 10 to 50 per 1,000 live births. So it is much higher in the developing countries. According to WHO and research data, approximately 15% of all the neonatal death globally is due to neonatal sepsis. Okay, now let's see the mode of infection. So newborns, they are highly vulnerable for infection because of their immaturity of immune defense mechanisms. So if you compare term and preterm, in preterm it is more common because in preterms the immune defense mechanisms is more premature or immature. So mode of infection can occur, or baby can acquire infection at 3 points. One is intrauterine, that is before the baby is born. While the baby is in the uterus, that time baby can acquire infection. Another is during the birth, during passes through the birth canal or during the delivery, baby can acquire infection. And then third is postnatal, that is after birth, while you are doing the resuscitation, while the baby is in the hospital or NICU, that time also baby can acquire the infection. So mode of infection is at 3 sites. Now come to the classification. I'll show you different classifications, but this number one classification, which is based on time of onset, is the most important one. So these two topics we'll discuss in detail today. So according to the time of onset, there is early onset neonatal sepsis. That means the sepsis or infection is occurring from birth till 72 hours of life. And some guidelines say it is till 7 days of life. Second one is late onset neonatal sepsis. So this is sepsis is occurring at 72 hours till 28 days of life. And some guidelines it mentions till 3 months. And then some places it says that from 28 days till 3 months of life, if the baby is having sepsis, then that can be termed as late onset neonatal sepsis. But broadly there are two types: early onset neonatal sepsis and late onset neonatal sepsis. Now the classification 2 is based on the etiology. So based on etiology, it can be bacterial sepsis, viral sepsis or fungal sepsis. But bacterial sepsis is the most common one, and when we talk about the neonatal sepsis, or when we mention neonatal sepsis, we are actually meaning the bacterial sepsis. So the common organisms or common bacteria which are involved in this is Most common ones are gram-negative organisms like E. coli, Klebsiella, Pseudomonas, Proteus, Acinetobacter, Cytobacter. And less common ones are gram-positive bacteria like Staphylococcus aureus, Staphylococcus albus, Enterobacter, and Clostridium. And then some other bacteria can be Haemophilus influenza, Listeria monocytogenes, or Enterococcus. And in the Western countries, group B Streptococcus is predominant. In the viral sepsis, common viruses are herpes simplex virus, enteroviruses, and cytomegalovirus. A fungal sepsis, Candida species, can be common, and fungal sepsis, if it occurs in a newborn, it is a serious condition and it is a life-threatening condition. Now, type 3 classification is based on the clinical presentations. So here, number 1 is clinical sepsis. This when the baby is having clinical symptoms, signs, symptoms suggestive of sepsis, but the organism is not isolated in the culture or culture negative, or this is a culture negative sepsis. Another is proven sepsis. This means sign symptom of sepsis is present in the newborn along with the isolation of organism in the blood or cerebrospinal fluid or in the urine culture. So this is culture positive neonatal sepsis. Or proven sepsis is clinical features with the culture positive. Sepsis is known as proven sepsis. Another is severe sepsis where there is organ dysfunction along with the features of sepsis. So commonly involved organs are respiratory and renal system. And then septic shock is a severe form of sepsis where there is a persistent hypotension and hypoperfusion in spite of your interventions. So this is known as septic shock. So these are the clinical presentation of sepsis or third type of classification. And fourth classification is based on the acquisition or the place where the baby acquires the infection. So according to this, it can be hospital acquired sepsis, also known as nosocomial sepsis, which is acquired 72 hours after the hospital stay, whether in NICU or the postnatal ward or in the nurseries. And this is associated with the hospital environment and the procedures you are doing in the baby. And another is community acquired sepsis. This sepsis occurs after the baby is discharged from the hospital settings or the hospital. So the baby acquires infection from the home environment or during the transport. So both these sepsis is occurring after 72 hours of life. So this comes under late onset neonatal sepsis. Now let's discuss the main two types of sepsis, that is early onset neonatal sepsis and late onset neonatal sepsis. So early sepsis, the source of infection will be prolonged rupture of the membrane leading to ascending chorioamnionitis. Chorioamnionitis is infection of the amniotic fluid and the fetal membrane, which is chorion and amnion, due to the bacterial ascent from vagina due to prolonged rupture of the membrane. And second is maternal genital tract during the birth or during delivery is another source. And third source is delivery, which is contaminated in the operation theatre or labor room while you are resuscitating the babies. And the common organisms for early onset sepsis are E. coli, Klebsiella, Listeria monocytogenes, and group B Streptococcus, which is in the Western countries. Now come to the risk factors for the early onset neonatal sepsis. It can be maternal risk factors or neonatal risk factors. So number one maternal risk factors is chorioamnionitis, which is defined as interpartum fever in the mother, which is more than 37.8 degrees Celsius with two or more of the following features. So number one feature is fetal tachycardia with heart rate more than 160 per minute, uterine tenderness or foul smelling, meconium stained liquor or maternal leukocytosis. So out of these three, if two or more than two features are associated with the maternal interpartum fever, then you can consider this mother is having chorioamnionitis. Number 2 risk factors for the mother factor is prolonged rupture of the membrane more than 18 hours. Number 3 is multiple, that is 3 or more than 3 per vaginal examination in 24 hours. Number 4 is maternal group B streptococcal colonization. Now the neonatal factors for the early onset sepsis can be very low birth weight babies with weight less than 1500 grams, prematurity with gestation age less than 35 weeks, and then male sex. And in early onset neonatal sepsis, respiratory distress is the most prominent clinical feature because congenital interatrial pneumonia is predominant presentation for early onset neonatal sepsis. Now come to late onset neonatal sepsis. This can be nosocomial or hospital acquired. Here the sources are incubators, resuscitators, ventilators, catheters, infusion sets, face mask, organisms from NICU and the postnatal ward. And the common organisms involved are coagulase negative staphylococcus, Staphylococcus aureus, Klebsiella, Pseudomonas, Proteus, Enterococcus, Citrobacter, and then fungus. And 2/3 organism is gram-negative organism. So always try to cover up the gram-negative organism along with the Staphylococcus if it is a late onset neonatal sepsis. Another type of late onset neonatal sepsis is community acquired infection, which is occurring after discharge of the baby from the hospital. So the source will be mother, the family members, the relatives, all the contacts who come to visit the babies, and baby care units are the sources for this type of infection. And the organisms involved are Streptococcus pneumoniae, tuberculosis, or the viruses. And in the late onset neonatal sepsis, predominant clinical feature will be meningitis, and there can be pneumonia, UTI also. So but always remember, while doing workup for the late onset neonatal sepsis, you have to always do the CSF analysis, so to rule out meningitis, which is very important workup for the late onset neonatal sepsis. Now come to the risk factors for late onset neonatal sepsis. Number 1 factor, very low birth weight babies. Number 2, lack of breastfeeding, because breastfeeding has very many beneficial factors, especially the secretion of IgA, which is a protective factor for infections. Another is frequent handling of the baby. If you are not washing the hand and frequently handling, that there is a high risk. Central venous catheters, mechanical ventilators are other risk factors, and improper hand washing is another very big risk factor, because only with the hand washing you can prevent neonatal sepsis to certain extent. And another risk factor is delayed enteral feed, because if you delay the enteral feed, there is a delay in colonization of the beneficial gut bacteria like lactobacillus, and it promotes colonization of hospital acquired the pathogenic bacteria if you are not feeding the baby in time. If you delay the feeding, again there might be thinning of the mucosa with the atrophy, and there might be delay in the enzyme production, delay in the gut motility. So many factors are there. So you should not delay the enteral feed. Another point is indiscriminate use of antibiotic is another risk factor for late onset neonatal sepsis. Indiscriminate use of antibiotic means either misuse or overuse of antibiotics. So antibiotics, they are not only killing the the harmful bacteria, they even kill the beneficial bacteria in the gut. So you should not overuse the antibiotic. And overuse of the antibiotic leads to survival of the or development of the drug resistant organisms. And with the indiscriminate use of antibiotics, there might be overgrowth of fungus leading to fungal sepsis, which is life-threatening condition for the newborn. So you have to be very, very careful while using antibiotic in a newborn. So another risk factor will be prolonged hospital stay itself is a risk factor for late onset neonatal sepsis. Now let's see the early versus late onset neonatal sepsis how it differs. Let's see the comparison between these two. So if you see the age of onset or time of onset, early onset is before 72 hours of life, late onset after 72 hours of life. The source of infection in the early onset is maternal genital tract or intrauterine also, and then during the resuscitation, whereas in the late onset it is the hospital environment and the community environment. The presentation of early onset sepsis is fulminant and it involves the multisystem, and pneumonia is a predominant finding or feature, whereas in the late onset sepsis it is slowly progressive, it is more focal, and meningitis is a predominant presentation. And in the mortality, early onset has a higher mortality with 5 to 10% mortality, and late onset sepsis there is 10 to 15% mortality. Now let's see the pathogenesis or inflammatory process in a very simplified form. First, there is entry of the pathogen which enters the bloodstream. Then there is release of the inflammatory mediators, the cytokines like thymonecrosis alpha, interleukin 6, interleukin 8, interleukin 1 beta. Then there is injury to endothelium. Then there is capillary leaks, and with the organ injury, which may be multi-organ dysfunction and then as severe as DIC, and then they present with the clinical features which may be very subtle till very severe, and then death also. So now we'll discuss the clinical features. So clinical features initially is very subtle and non-specific and vague. So you may miss the diagnosis, or there might be delay in the diagnosis. You should always have a high index of suspicion to diagnose neonatal sepsis. Very early features are lethargy, sluggishness, poor sucking, poor cry, irritability, hypothermia, loss of or inadequate weight gain. So which may also be features of some other conditions like hypoglycemia, hypothermia. So it is very confusing whether it is a sepsis or whether it is some other condition. And there might be off color, which is pale. Baby may be less alert, less active. Many times mother notices this less activity. So whenever mother complains about this type of features, you have to be careful and have a suspicion for neonatal sepsis. And then if you are getting a feeling that baby is not doing well, if you get that type of feeling, it's always good to screen the sepsis than delay the diagnosis. Now we'll discuss different features in detail. So number one, there is temperature instability, which may be hypothermia. Usually in the preterms there is hypothermia. In older babies there can be fever, but hypothermia is a more predominant feature in a sepsis. Central nervous system finding, there can be lethargy, refusal to suck. 30% babies may have bulging anterior fontanelle, high-pitched excessive crying, convulsions, not arousable, irritability, hypotonia, abnormal Morose reflex, and apnea are different central nervous system finding in a sepsis. Cardiovascular system, there can be features of shock like pallor, cyanosis, cold and clammy skin, capillary refill, leaking more than 2 seconds, prolonged, that is indicating hypoperfusion. Ashen grey color can be noticed, mottling skin can be there, tachycardia, bradycardia, or hypotension can be there. In the respiratory system, there can be tachypnea, apnea, grunting, cyanosis, or retractions. In the GIT, there might be features of necrotizing enterocolitis, which may be vomiting, diarrhea, abdominal distension, or blood in the stool, and intolerance or not tolerating feed is the very early feature. And hematological, there can be bleeding manifestations like petechiae, purpura, there can be DIC, pulmonary and intraventricular hemorrhage can be noticed. Jaundice, pallor, hepatosplenomegaly are other hematological findings. In the renal, there can be oliguria indicating acute kidney injury. Oliguria indicates a hypoperfusion also. In the skin, there might be rashes, purpura, or pustules. So more than 10 pustules are significant. And there can be another skin finding known as scleroderma, where there is a diffuse, firm, waxy hardening of the skin and subcutaneous tissue. It is non-pitting, it is non-inflammatory, unpinchable, and it involves face, chest or legs. Sometimes this is even known as woody hard, because it is giving a feeling of woody hard because there is a hardening of the skin and subcutaneous tissue. So these parts, face, legs and the chest becomes very hard in scleroderma. And metabolic acidosis and hypoglycemia are other features. Now let's see the natural course of the sepsis. Initially there is bacteremia which may invade the bloodstream, known as the bacteremia, or there is focal infection in any other site of the body, and then ultimately it enters the bloodstream. And there will be early features of sepsis followed by severe features of sepsis, ultimately leads to early septic shock, then refractory septic shock, and then multiple organ dysfunction syndrome, leading ultimately to death. So this is a natural course of sepsis. If you don't treat, ultimate result will be death in a sepsis. So early intervention is very, very important. If you can suspect or if you can diagnose sepsis at this point, the prognosis will be very good. Okay, thank you. And next class I'll continue with the lab investigation and management of neonatal sepsis. Hope this class was helpful for you. Thank you.